Yes. Hello and welcome to Seven Sentinels. This is Grandmaster class and I'm Peter Simon with you. This is a part of the classical corrections group, preparation for OET, Occupational English Test. This is a speaking warm-up session, the complete test of course. The first part is warm-up session, then we'll have 2 role plays. And this is a live session for realistic practice. So today we have Sangeeta Leema from Dubai, United Arab Emirates, originally from Bangalore, Karnataka, India. She is preparing for her nursing specific occupational English test. And this is her speaking test. And now the warm-up. Hello, Sangeeta.
Hello, sir.
Yes. These are the daily dosage, profession-specific speaking materials, and nursing profession-specific speaking tasks. Sangeeta, can you please tell me something about yourself in 3 to 4 sentences?
Yes, sir. It gives me an immense pleasure to introduce myself. My name is Sangeeta Leema. I am a nurse by profession, basically from India, place called Bangalore, currently living in Dubai for the past 14 years. My mother tongue is Konkani, but I can speak other languages such as English, Hindi, Arabic, Kannada, Tamil, Malayalam. I love my country because I am patriotic by nature.
Why did you choose nursing as your profession?
I chose nursing as my profession because of a variety of reasons. First of all, it was my childhood dream to become a nurse. And I was inspired by many nurses who took care of my brother when he was hospitalized after the accident. And nursing is a profession which gives you ocean of opportunities to work in India as well as abroad. And in nursing, you deal with the human beings, and I enjoy routine. So that's the reason I choose nursing.
What is your fundamental reason for taking the occupational English test?
Occupational English test is specially designed for the healthcare professional, and it is one of the mandatory tests which is required to for anyone who's planning to move to the Western countries. My plan is to move to United Kingdom. That's the reason I choose OET.
Which country is your most favorite destination for migration and work?
Yeah, I'm planning to move to United Kingdom because it has world best hospital and there are a lot of job opportunities for the healthcare professionals. And rules and regulations in United Kingdom is very flexible. And there the nurses are paid well and respected too. That's the reason I like the place.
Comment on the special qualities of the contemporary nurses.
Contemporary nurses nowadays, they have a lot of qualities. Like first of all, they should be having critical thinking and problem solving skills, which help them to deal in any emergency situations. And first, the nurse should have good communication skills, which help her to interact with her patients as well as maintain a good rapport with her colleagues. And more than that, the nurses should have other qualities like punctuality, dedication, honesty, etc.
What is the regular routine of an ideal nurse?
Let me explain my routine as a nurse. Usually my day starts with a prayer. After that, before taking over from the previous shift, I'll do my special assignment like checking inventory and checking the crash card. After that, receiving a patient from the previous shift. After I receive a patient from the previous shift, I'll try to go and interact with the patients, which help me to provide a better quality care. Then after, based on my assessment, I'll be preparing a nursing care plan. And depending on that, I provide a quality of care to my patients. After my routine care, I'll be having a time to assist the doctors in their rounds, then giving the medication, dressing, other things. Meanwhile, I'll also get a time to interact with my colleagues and maintain a good rapport with them. And end of the day, by the time my day will be finishing, I'll be handing over the patient to the next shift.
The last question for now, a role model. As far as your profession is concerned, who is your role model?
Mother Teresa is my role model because she's also known as Mother of the Poor. With her own example, she explained how the nurse should be, and she served the humanity without even expecting anything in return. She was humble, honest, and moreover, she was loved by all the people. That's the reason I like her and I choose her as my role model.
Right. That's very nice talking to you, Sangeeta. Thank you very much. Have a nice day.
Yeah, thank you, sir.
Yes, that was the warm-up session. And then now we are going for the role play, which you have taken. The role play number, yes, 1 second, let me check it out, what role plays you have selected for today. Okay. Sangeeta, okay. Sangeeta, you have sent cards. Where are they? This is the first one is card number 22.
I'll do first
And next
card
one is
number
30. 22 and 30. Okay. Okay, let us see. No problem. Whatever you want to do, you can do. But let us see. 22 is one. This is 22nd card. Okay. This is interlocutor. And this is the candidate card. Okay. Is this the one you wanted to do? Or is this the one you wanted to do first?
card number 16.
Yes, then you go. Okay. Fine. So it is split down. Okay. So candidate role play card. So I don't want it to be small. So what I'll do is I'll make it a little big.
No, sir, I have on my screen. I can just see, no problem.
Yeah, you can have. No. The people who are watching, okay, they should also be clear. Nah? Okay, fine.
How can I address you, sir?
Yes. Right. Let me check role play card. This is your nurse card and this is my role play card is there on my tab. Okay. So I have to take the second card. Second card is number 30. Okay. Yes. You are an 80-year-old client. Okay, fine. Right. And then going to the career. I am Abraham Lincoln. And you can call me Lincoln, Mr. Lincoln. Is that clear? So you're ready, you have prepared, right? Hello, Sangeeta. Hello. Hello, Sangeeta. Can you hear me? So you have 3 minutes to prepare. So 3 minutes preparation. Yes.
Sorry, sir, there was internet problem.
No
Sorry.
problem. That's okay. That's okay. Yes, you can start. So,
Yeah, you were telling me Abraham Lincoln, so I can call you as Abraham.
yes, you can call me Abraham Lincoln. So, my name is Abraham Lincoln, and you can call me Lincoln. So,
Okay, 1 second.
so this is the card.
Shall I start?
Yes, dear.
Hello, good evening.
Good evening, nurse.
I'm looking for Mr. Abraham. Am I at the right place?
Yes, nurse, you are. Please come on in.
Thank you.
This is my house.
Yeah, thank you, Mr. Abraham. Mr. Abraham, is it the right time to talk to you?
Yeah, of course, you have already come here. So get on, get going.
Okay, Mr. Abraham, my name is Sangeeta. I'm the community nurse. I'm here to do the conduct an age care assessment for the admission. So tell me, how do you feel about it?
Nurse, let me tell you frankly, yeah, I am very happy to go into care because you know my family, they are very dear to me. And let them have a pleasant time and some productive time. Let them have some memories. Okay, I want them to go relaxedly without any tension. I should not be a matter to bother.
Yeah, first of all, I appreciate you, Mr. Abraham, because you have taken a positive attitude, and it shows that you're worried, you are thinking about your family, and because of them, you are ready to sacrifice and you plan to move to the retirement home. Is that correct?
You are absolutely right, nurse. But one thing, let me tell you, you know, I am an octogenarian and I have lived fairly independently for a number of years. Okay?
Yeah,
Then, now, what this is, here I am. I'm a little worried about the lack of privacy here.
I can understand your concern, Mr. Abraham. Don't worry. The retired homes nowadays, they have flexible rules, and I assure you that you'll be feeling more comfortable. You'll feel like a home environment only. That the expert nurses are there, and they'll be taking care of you. More than that, the residents over there will be the same age of you, so where you can share your interests, you'll be enjoying. So, what do you think about it?
Yes, nurse, that's really fine. But what I'm asking is, I don't know how I'm going to socialize with the people who may not share my favorite pastime. And, I enjoy many things and I don't want to miss those interests.
Yeah, I do understand your worries, Abraham, but don't worry. We'll make all the necessary requirements for you. So before proceeding further, is it okay? Shall I ask you a few questions to know more about your daily routine?
Yes, definitely, nurse. I am ready to give you the information you require. Come on, shoot your questions, please.
Okay, tell me, Mr. Abraham, do you suffer from any medical condition?
Actually, I don't have any problem at all, But,
Okay.
I have some medication, I have some medication. I have to take them regularly. Otherwise, nothing.
Okay, would you mind telling me which medications are you taking regularly?
Okay, I take some blood pressure tablets, Atacand, and
Okay.
a medication to control acid reflux period. And
Oh,
I have some occasional analgesic medication whenever required. That's all.
okay. Do you have allergic to any medication?
No, nurse, I am not allergic to any medication. But actually, I am little bothered regarding something else. I don't know whether, yeah, can I have the permission to discuss those things with you?
Yeah, sure, sure. You can go ahead and tell me.
Yeah, I have my own priorities and I don't want to sacrifice those things for anything else. This is the
Okay.
first. Number one, let me tell you about my routine. I sleep in and I have a late breakfast and I shower without any assistance, then pursue my favorite pastime, and then I have lunch and have an afternoon nap, and then watch a game. Then I'll have see the evening news. Then bed I'll be by 8:30 p.m.
Okay. What about your meal preferences? Do you prefer any specific meal or something?
Yeah, I don't have any specific preference, but mostly I can say I like vegetarian meals over non-veg. Once in a while, weekly once or maybe twice, that's okay. Otherwise, I prefer vegetarian meals.
Yeah. Thanks for the all the information, Mr. Abraham, and thanks for answering all my questions. I have noted down all your requirements, and I'll be sending this one to the retirement home, and they will be noting down all your interest. And I'll also make sending. I'll be sending this letter to them, and also will be sending a copy to your son also. So, is there anything else I can help you with?
Yes, of course. One more thing is normally my son and my family members take me quite often for meals and movies, but now because they are going for a trip, yes. And now what I want to do is I will request my friends and some relatives or neighbors to come and take me or whenever I feel. And I hope there is no objection for that.
Yes, the way there is no, as I told you, our retirement home, they have flexible rule, and they will be adjusting to anything. What all the requests you have, you can just tell them, and this will not be a problem. So, other than that, anything else I can help you with?
Yes, I have told you my favorite pastime, that is playing video games, and maybe some sort of disturbance may be there for the other people. So I'll minimize the sound, but I think that will not be any problem to you because I'll bring all this, equipment with me.
Yeah, sure, that will not be a problem because the people also of your same age, they also like the same thing. And since you'll be given a separate room, and I assure you that it will not be missed and will be respecting all your decision. So you can free of tension. Do you have
Right.
any other queries?
That's very nice talking to you, nurse. Thank you very much.
Yeah. Thank you, Mr. Abraham, for your cooperation. I have noted on everything and hope I was able to clarify all your doubts. And in case if you remember anything, this is my number. You can call me. I'll be happy to assist you at any time.
Yes, that's a very nice, nurse. Thank you very much. So now let's move on to the next role play. Yes, here is the second role play. This is your card, nurse card.
Yeah, how can I address you, sir?
Yeah, yeah, you can address me, Maggie, because my name is Margaret Thatcher.
Shall I start?
1 second, please. Let me take my role play card. Yes, here you are. Yeah, that's it. You can start.
Hello, good evening.
Good evening, nurse.
My name is Sangeeta. I'm one of the registered nurses working in this ward. I'm your assigned nurse and I'll be taking care of you today. How are you, Miss Maggie?
I am absolutely fine, nurse, but I want to be discharged because I'm feeling better and I am quite comfortable and I'm able to manage everything I feel. Why am I kept here for so long?
I can understand your worries, Miss Maggie, but do you know anything about your condition?
Yeah, I can feel it. I don't know 100%, but I can definitely say that I'm fit and fine, fit as a fiddle. And why should I not go back home?
Your concerns are justified, Maggie, but you told me that you are thinking that you're fit, but as per us, your condition is still not stable, and you were diagnosed with acute pyelonephritis. Do you mean what is that?
I don't understand exactly, but I can tell you I can manage. I can consume food or fluids or whatever you give. I'm going to manage with all these things. And yeah, I don't know why the doctor feels that I'm not ready to be discharged. You know, I have two children at home and who are being cared for by my husband, and I cannot overburden him. I'm desperate to go home and I'm really upset and I'm really angry about staying here. Please, nurse, do something and I want to move from here.
I can understand your concern, Maggie, but since your condition is not stable, we tried to give you oral fluids and oral medications, and you know that you are still running with a high fever and you're not able to tolerate anything because whatever you're eating, your body is rejecting the food, fluids, and the oral medication which we have been giving you. So that's the reason we have started you on intravenous therapy, and at this stage your condition is still not improving. Until you get further improvement, you may have to stay in the hospital. The reason why is will be keeping close monitoring on you, and since we started the antibiotic, we may have to do the frequent test like blood and urine test, to track the infection. Are you able to follow me?
Convince me, nurse, why I cannot carry on with all these things at home. Is that
Yeah.
not possible? Definitely, because many times, you know, when patients are there at home, they will provide all these things. The nurse comes, why don't you do that for me?
Yes, I do agree with you, Maggie. But the reason here is, kidney is the vital organ of the body, and further damage to the kidney can have kidney failure in future, because kidney is the organ which filters the waste product. And if you neglect it in the initial stage, you may develop into, like, there are chances of, when the waste product doesn't go out from your body, there are high risk of blood poisoning. And all these things, in case of emergency, all things is not possible at home, because at home you will be alone, and by the time you come back to the hospital, it will be delayed, and you may develop into some other complication. Hope you understand.
See it from my angle, nurse. I'm a mother and I have people who depend on me. And how long can I stay here leaving them?
Yeah, Maggie, I can understand.
How can I manage? How can they manage all by themselves?
Yes, Maggie.
I'm not very much convinced to stay here, but if there is some possible option that they are taken care of, my children especially.
Yeah, Maggie, I can understand your concern. Yes, what I can do is I have a solution for that. Let me talk to the social worker in your area. So I'll tell her to talk to your family. Maybe she can provide some extra support for you. So in that way, you'll be free of tension from your family side. So you can at least concentrate on your treatment here. How does that sound?
That's really wonderful, nurse. You have taken out words from my mouth. Thank you very much.
Yeah. Is there anything else I can help you with, Maggie?
Presently, that's all, nurse. I'm okay. Now I agree because you say you have given me this option. I'm pretty much, comfortable, Thank you very much. That was a very
Okay.
good suggestion from your side. Thank you once again.
Yeah. Thanks for your cooperation also, Maggie. Hope I was able to clarify all your doubts. And if you have any other queries, just press that buzzer. I'll be happy to assist you at any time. And I wish you a speed recovery.
Thank you, nurse. Thank you once again. Okay, right. So, Sangeeta, The day
Yes,
after,
sir.
you're going to do your exam.
Yes, sir.
And I think you are on air. That means this is live, telecasted. You can see, go there, you can study your feelings, you can study your facial expressions, you can study your fear, you can study your confidence. What all you want, you can see there. You can see as if you are an onlooker, an audience. You can study from your, from your speech, what you have spoken, how you have spoken, everything. You can see there, and what you could have done it to improve, what you could have tried to improve it. So tomorrow morning I'll give you another speaking session, and tomorrow afternoon I'll give you one more speaking session, and tomorrow evening I'll give you one more speaking session. So 3 speaking full sessions you will have tomorrow, and if possible tonight, if you're there after say 11:30, okay, I'll give you another speaking session. So totally 5 sessions. That would be the finishing touch for you. You are doing very fine. But the thing is, you have to gain a little bit of confidence. The way how you're speaking is little monotonous or flat tone. You are not creating an impact on, you're just trying to answer the questions, but you can see a person who has command over the subject will never bother about what the questions are. Who is the other person on the other side of the screen? What is happening? Where am I? Live session or normal session? Whatever it is, devoid time, situation, person, place, anything. Don't bother about anything. Just feel that you are the master of the situation, and attack is the name of the game. You are afraid and you lost it. A person who is afraid is already half dead at the very beginning of the test itself. So remove your fear, dig it deeper and remove the roots of a fear and throw them in the garbage bin. That's what it is. Least bit. That's why I'm bringing you live, so that you can gain that confidence and you can see where you are doing some, because you can watch it, or you can watch it on the YouTube directly on the television, play it on the television. I'll give you the link, you play it on the television and you'll see your facial expressions very clearly, and you can understand how depth you are talking, how you are talking, was there concern towards the patient, was there fear or not, was there that level of confidence or not. Everything is fine with you except that, tone, flat tone. Sometimes you have to go up and down like that, right? Yes, Mr. Lincoln. I totally agree with you. This is a common thing. I really appreciate you for your concern regarding your children's happiness. Not everyone will think like what you are thinking or how you are thinking. So I'll see that all the possible measures are taken to make you comfortable. See the way how you have to explain, how you have to present. I'm giving you the feedback. You're doing awesome. You're doing excellent. It will cross 350, definitely. But what I'm telling you is, why don't you get 400 above? You can get it. You're doing fine. Maybe just because you're on air, live, maybe you were a little bit. Otherwise, you are doing well. In the previous sessions also, I know you're very confident. So try to practice. Try to practice. See the way how I'm speaking. I'm not a native speaker. Definitely, I'm not a native speaker. But we can become near native. We cannot speak like how the native speakers speak, but to some extent, we can reach to some level, at least 25% or 30% or something. So what you have to do is, there is nothing important. Speak with your heart. Speak with your heart. Show that emotions, show that feelings. Don't exaggerate. Don't make too much of it. But feelings, Yes, there should be a smile on your face. Mr. Lincoln, I really appreciate your response to this particular situation. You're not bothered about yourself. You're ready to stay in a care home. And you want to see your children enjoy their trip happily. So the feelings should come. Feelings should come. Yes, Maggie, I totally agree with your opinion. Being a mother, I can understand in what situation you are. But as a nurse, my suggestion is that you remain here. Better recover fully and then shoulder the responsibilities rather than shouldering the responsibilities even before you are fully recovered. You are wise enough. You can decide. If you're fully recovered, then you can take 100% responsibility. Otherwise, you cannot reach the expectations. If you're fit and fine, then everything will be fine. Even your family members will not be ready to accept your services in this condition. So, the better option is remain here, get completely cured, and then go home with rejuvenated energy. So this is the way how you can impress the people. Feelings, 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 facial features, expressions, body movements, eye twinkling, nodding the head, all these things you have to do. Don't you do in the real life? If you are a nurse, don't you? Yes, Sangeeta, you're right. You have some problem. I understand that, but there is nothing to panic. The problem is you have a flat tone. Try to speak as naturally as possible. See how I am creating that rippling effect. You have to make the other person spellbound. Little, but the better presentation. No need to speak too much. Whatever you know, create that style of yourself. Be a human being first. If you are a human being, you will have all these good qualities. Compassion, love, affection, responsibility, a feeling of togetherness, of bondage of work-related affection. Heart melting for the patient, heart beating, wishing for the betterment or improvement or enhancement of his condition. Feel that he is your relative. Feel that he is your son or daughter or father or mother or brother or sister or whatever you feel that he is something special to you. It's like how I am feeling. You are something special to me. That's why these feelings come. If you are a normal student and I'm a normal teacher, these feelings will never be there and my presentation will not be the same. Be as natural as possible. Be the best. This is your game. Don't take chances. Dance the tide. This is your warfare battle. Do everything. 1 second you miss somewhere, you are dead there. The enemy is in front of you. He will rip you off. He will skin you off. He will cut your marks. This speaking audio will be taken by the person who is evaluating. He will cut off marks. Strength is in you. I don't mind anybody. It is my game. It is my game. 75% I have to speak. 25% only he has to speak. You try all the options. The best possible options. You should come out happily. Every second there should be a smile on your face. There should not be a bit of fragment of fear on your face. No tension, no worry, nothing. It's a part of life. You have a lot of experience in realistic situations, in the professional scenarios. Then why do you fear when you have so much of experience? Is it because you are speaking in English? Don't you know English? Don't you speak naturally? Speak naturally. Many people want to do it artificially. There is the problem. Even I myself, nothing is artificial. It's coming naturally. A live dog is better than a dead lion. A live dog is better than a dead lion. Dead lion is worth nothing. Dead lion is worth nothing. A live dog is more than a lion in front of your house. So be a live dog, not a dead lion. So what you have to do, you have to pounce like a dog. That's it. And roar like a lion. No problem if you are not a live lion. That's it. Do your best. Prove that you are best. Don't panic. No worry. Because here, your grammar, your vocabulary, your pronunciation are the major concerns. How you are going to improve? Real situation. The other person is a patient and I am the commander. I am the more important person. I am the authority over the subject. The information is passing from me to him. Don't fear, don't panic. There is another patient for you. He is not the examiner. It is not the OET representative. He is not the interlocutor. He is not anything. He is just another patient. Mind you. Is that clear?
Yes, sir.
I have given you everything. I have given you special dosage. If you can sense what I am telling you, attack.
Sure, sir.
Just another patient. You are the professional nurse. He does not know anything. You know everything. You are the master and he's just taking the information. He's just a baby and you are the mother. Actually, he's worried, he's tense, he's upset. Why you are feeling upset? Why you are feeling tensed? Take the command in your... Don't shoot one arrow, shoot 3 arrows. You are a Bahubali. That's it. The warrior. Don't shoot one arrow, shoot 3 arrows. If he tells you, what should I do next? There is nothing to worry regarding this, my dear gentlemen. It is quite common in such cases And you are not the only person who is facing this situation, as every other individual has recovered from grave, even worse condition than yours. And let me tell you frankly, you are not in that difficulty. It can be managed well. And if you follow my suggestions, the sooner the better is your recovery. Try to play the words as excellently as possible. Dance the time. This 5 minutes is yours. Do the best. Whatever you do before is not counted. Whatever you worry after will not be counted. Whatever you are doing within this 5 minutes time, 300 seconds is in your fist. Don't let it go. Don't let it go. Hold it strong and give a big blow. That's it. Speak spontaneously, on the spot. Don't be very fast. See how I'm speaking? It's okay. It's okay. Fluency doesn't mean that you speak very fast. Fluency doesn't mean you speak at an average speed. Fluency doesn't mean you are speaking very slowly. You can speak very fast. You can speak at an average pace. You can speak very slowly. There is no problem. Fluency is that one without a break. It is going straight like a wave from the beginning till the ending until there is a comma or a full stop. From the beginning to the ending, you are going on speaking and speaking and speaking and speaking, and you stop only when there is a full stop. And zip your mouth. Don't open and you'll get a sound. Don't open your mouth at all. Is that clear?
Yes, sir.
I hope I did not blast you, and I don't think I'm giving you too much. You deserve it. You are my child. You are my child. I am delivering you into the battlefield. I am your mother. And, I prepare you well and I'll send you into the battlefield. You are a very obedient student. You listen to me 100%. Whatever I told you, implemented. I told you just do it and leave the rest to me, and you have done excellently well. Okay, right. Do your best. That's all. Anything?
Okay.
Now tell me, what did you learn from this feedback? How was it? Was it beneficial for you, the feedback? How was the session? How was the warm-up? How was role play 1? How was your role play 2? How was the session? How did you feel? Were you confident or scared or worried? In the beginning, you were afraid a little bit or worried or, maybe messed up. Afterwards, you recovered and you really stepped into the battlefield. No looking back. You explain from the beginning to the end, 20 minutes we had. You had, not I had afterwards. So this 20 minutes experience in your own words, how did it help you or break you or build you? Come on, the time is yours. It is just 2 minutes for you.
Yeah, overall, it was good, sir, because it also helps me to prepare for the exam also. It's the same thing going to happen. Maybe because of my stress, I was not concentrated more on the action and all that. So you also told me that that also matters. But then again, maybe the exam stress and the time, so we are not concentrating on that because we are only focusing on the task. We should not be the one. Maybe when whatever the point which you told, if I apply, so that will help me another bonus point,
You will get A grade.
Inshallah.
Okay. You'll get A grade. So do the best, do the best, do the best. So overall, yes. So which areas have you to improve now?
Means,
What are the areas? What are the areas you have to improve?
you mean in the speaking?
Yeah, in speaking, what are the areas
Yes,
you have to improve?
speaking, you told me about the tone. So the tone should not be the same thing.
Now you are
And,
speaking nicely.
Yeah. So
Now you
that
are
time,
speaking nicely. That means you're naturally you're speaking. Why don't you apply that natural speaking in your speaking session itself?
I'll do, sir.
Be natural. No, don't think that it is an exam. Okay. You think that the other person is Simon Sir only, or you think that the other person is patient. If Simon Sir little bit fear still will be there. But if you think that the other person is a patient, even me, you should treat me as a patient only. You should not see anybody. You should feel, and even my expressions are like a patient only, right?
Yeah, there it depends on, because that 3 minutes time preparation is there. No? So that moment
No
we'll be
worries.
thinking like maybe now they will tell us to start. Now they'll be telling us to start. So thinking of that will not be able to prepare the task properly. All that is a matter of time and stress and also. So maybe even
Very
the
good.
simple
So
things.
fine, you relax now. After
Okay, sir.
11:30, just message me at 11:30. Okay.
Okay.
If you are available, then I'll take another speaking session. And
Okay,
tomorrow
sir.
we'll schedule 3 speaking sessions. I will not call you. Okay. You have to remind me.
Okay, sir. Yeah,
Okay,
thank
dear?
you. Yeah, thank
Take
you.
care.
Thank you.
So that's the end of the session. Have a nice day.
Yeah, you too, sir.
One second. Where is this?